How should I start talking? Hi, hello everybody. I'm Dr. Ruben Bhasin Passi, consultant dermatologist at CK Birla Hospital, Gurgaon. As the Diwali has already been done and our skin is already so much damaged, today's lecture is going to mainly focus on how to take care of your skin for the forthcoming pollution and also the Diwali blast that your skin has. So today's session we'll be majorly talking about air pollution, how it affects your skin health, what to do, what should So sorry, one second. Yes. So, what should be your skincare routine? How to take care of your skin. By the end of the session, last 10-15 minutes, we'll be taking up questions from you. Whatever concerns you have, whatever confusions you have about the presentation, we can go ahead with that. All right. I'm starting with it. इसको full page कर सकते full screen कर सकते हैं इसको full screen करना इसको full screen थिंग यहाँ होगा ना Yes. All right. So today we'll be unmasking the impact how pollution affects our skin health. Now, like I told you, the flow would be introduction on types of pollutants, how to prevent yourself, skincare during these times, and lastly, we'll also touch something about glass skin myth and facts. Um, just one second. Has been a little glitch. I'm so sorry. उसको अनजूम कर दो ऐसे किया था All right, great. So sorry. So pollution is basically contamination of Earth's environment, which by the end affects us, our body, our health, and the quality of life. So in pollution, we have types are water, air, noise, and soil. Today, majorly, we'll be covering about air pollution, the health related issues it has, and how it starts to occur on your skin. When I talk about pollution, you only think about the pollutants that are outside your house. You do not majorly consider which are some indoor pollutants also. So in today's presentation, we'll be covering on both the areas. Uh, one second. इसको थोड़ा unzoom कर लो, probably. Okay, so air pollution is actually this generation's silent killer. in 2019, WHO considered both indoor and outdoor, something that I was talking about, as the biggest environmental health risk. The new estimate reveals that 9 out of 10 people, they breathe air that has high level of pollutants. Now when I talk about pollutants, we have indoor and outdoor both. So we can think about soot, smoke, mold, pollen, methane, carbon monoxide as well. Not only it affects your skin, but your cardiovascular system, that's your heart, your lungs, your nervous system, that's your brain, and also major part, which is the heaviest organ of your body, your skin. Now, the increase in pollution is majorly causing a lot of human skin issues. When I talk about pollutants, they would be UV radiation, that is the UV rays, PAH, that is polycyclic aromatic hydrocarbons, VOCs, that is volatile organic compounds, oxides, and PMs. Ground level ozone, cigarette smoking, all of these are the barrier damage causing agent. So the barrier repair has to happen, how we take care of it, but all these agents, they damage the barrier of your skin. What they basically do is they cause oxidative stress. I know, very medical word, but inflammation increases in your body. That gives a lot of aging, cancers, and if there are certain chronic inflammatory diseases like psoriasis and acne, lichen planus, they happen to occur more. As the pollution is on a rise these days, in my OPD, I'm seeing a lot of allergic conditions, meaning a lot of scratching and itching throughout the night, especially when they reach home after work. So, all of this we can actually give, it's all because of the pollution. Now, some people have a very drier skin type. It is going to get further dry because of the pollution. Kids have atopic dermatitis, eczemas. They are going to get worse with that. So, when I talk about PAH, it's majorly associated with aging, pigmentation, majorly on the upper side of the face, some acne, and of course, atopy, that we call is a dry skin in kids, which sometimes goes to the adults as well. So, dry skin is one big problem with pollution. Now, when the skin interfaces with the atmosphere, all we think is that we have to protect our face. Actually have to protect our body. How? The absorption is through inhalation first. Second is by the hair follicles. So, from your scalp to your body, your hair follicles are actually taking in the pollutants that are in the air. Inhalation, meaning you're breathing. Ingestion, of course, when you're opening your mouth, it's going in through that as well. And of course, through transdermally, meaning through your skin, it's anyways going in. So there have been certain studies conducted wherein they could see that it is also seen in humanly bodily fluid and also in the hair, like I just told you about. So, what are the pollutants we'll be covering today? UV radiation, cigarette smoking, polycyclic aromatic hydrocarbons, ground level ozone, PMs, that is particulate matter, volatile organic compounds, oxides, and heavy metals. Now, when I talk about UV radiation, the first thing my patient says that I do not step out of the house. Why do I need a sunscreen? So you can read on the second line, there are three types of spectrum that happens. B and C does not reach the earth as much, but UVB and UVC are majorly found in your LED, laptops, the lights that are emitted from these devices. These spectrums are there. Which is damaging to the skin is the UVA spectrum. Our major sunscreens and the protection that we always advise you to use a photo protection is from UVA. Now, the depletion of stratospheric zone that we talk about, the ozone, by environmental pollutants increase the penetration of shorter ultraviolet wavelength to the ground level. Hence, the UV radiation on the human skin differs by the wavelength. There is something known as intrinsic aging. So, if you can see the pointer on the left side below, the image shows intrinsic aging. This is a natural biology of, or maybe you can say physiology of the body to age. So, this is an intrinsic aging. That's how it shows when when a human ages. That's how it shows. But when I talk about extrinsic aging, it's on the right side. It's majorly, I can definitely see in younger age group, uh, no sunscreen usage, and of course, major pollutants which cause all of these skin changes on the body. So when I talk about UV, I will definitely see a lot of aging, pigmentation, a lot of rashes. We call that elastosis, and some redness on the skin as well, which is very regular. UVA, we all know, ultraviolet is a common pollutant. I just told you. When it mixes up with the PAH, that is the pollutant, with visible photo damage, I would want to you to think about the extrinsic aging, that is much more damaging than the intrinsic aging. With in combination with ozone, it causes oxidative stress in human skin. Now, there is a reduction of more than 50% of UV radiation, mainly UVB, on the days when the level of pollution is high. B is better than for B is better than A for us. So on the level, the days where the AQI is touching the roof, you definitely know the B and C are definitely not there. This is the most important topic, I believe, because we have a lot of people who smoke without knowing the impact which it causes on their skin. So, cigarette smoking is. Okay, so cigarette smoking, it's a highly complex aerosol. It will increase the free radicals, that is, the oxidation will increase, it will increase the inflammation. Now, the people who are very regular at cigarette smoking will have more dry skin. Why? The water loss from the skin increases. The degradation of the connective tissue, that is the deeper layer of your skin, the bed of your skin, that goes down. When I talk about how I can differ in my OPD, the patient has very typical of cigarette smoking history. Number one is the deeper or vital wrinkling. So we definitely see a lot of wrinkles here. Number two, we see a characteristic pattern of the aging that starts to happen. The skin color also changes. So there is definitely orange to purple skin coloration of the face. The bony contours, meaning the bones here and here, they definitely become more prominent because of majorly muscular activity on this side. Regardless of sun exposure, the regular heavy cigarette smokers have 4.5 times more likely to have facial wrinkles than non-smokers. I will definitely see more comedons happening on this area. We will see more smoker mustaches, meaning hair and beard, it starts to get gray. Premature aging, premature graying of hair. Smokers' pigmentation, that is the teeth pigmentation, and also the tongue pigmentation starts to occur. These are certain side effects with cigarette smoking that happens. So we've covered majorly. So again, comedons are the acne that I was talking about. These are the comedons that we are talking about. And certain chronic inflammatory conditions like hidradenitis suppurativa and all that, some cancers, because it majorly increases the inflammation in your body. PAH, that's polycyclic aromatic hydrocarbons. Main source is wood burning, automobile exhaust, diesel fumes, production of plastics, these pesticides, again, cigarette smoke. They are the major sources. What it basically causes is, always remember, premature aging, also extrinsic skin aging, any skin aging which is happening because of external factors. Pigmentation, when I talk about pigmentation in pollution or pollutant damaged skin, it's majorly going to happen on the outer aspect of the face and on the sides of your mouth and the nose. Chloracne is also one condition wherein it's because of chlorine the acne starts to happen. These days, I'm seeing a lot of that as well. Again, PAH is held responsible for that condition. Ground level ozone. This is basically ozone is basically a part of stratosphere. When it touches the troposphere, that is when it becomes toxic. We've seen a smog these days outside. It's the photochemical smog. It is because of the ground level ozone. Because with the sunlight, hydrocarbons, VOCs, this becomes a GLO, that is ground level ozone. Now, what it basically does is it decreases the vitamin E concentration in the skin. I'm sure a lot of you know about these little capsules which you put on the skin and they are for vitamin E, right? So, that is targeted by the ground level ozone. That is, the normal vitamin E concentration goes down. Hence, the normal skin microflora. There is a normal pH and flora which occurs on your skin that happens to shift down, which leads to a lot of dryness. Hence, people suffer with a lot of urticaria, eczemas, contact dermatitis, a lot of redness, itching, which leads to a lot of bleeding and pigmentation. Increase in infectious diseases, like I told you. Particulate matter, major sources are factories, power plants, automobile constructions, natural wind-blown dust, and some, again, these will put an oxidative stress on the skin. So you see wrinkle, dull skin, acne, a lot of pigmentation. Suddenly you will look a little more aged than you were probably 5 years back. Normal aging process happens, but because when the skin is exposed to pollutants, it will happen more than usual. Hence, we will see more on the forehead, lips, cheeks, nose, and less coarse wrinkles. So, extrinsic aging will be less, but the superficial aging will be a little more. VOCs, that's volatile organic compounds. When I talk about that, now they are basically the organic compounds which are which are needed to paint the cars or the house or the environmental smoke, stored fuels, exhaust from the cars. They will majorly cause an allergic rash. That's an atopic dermatitis, we call. That's majorly in children. So people who complain that we recently bought a house and we shifted in and our child is having these rashes, it will be because of the VOCs that is found in the paints. Now, in summers, it majorly causes a summer photochemical smog. I've put a diagram here, like a picture showing difference between fog and smog. I hope both of you, both the pictures are appreciable and you can see what's the difference between fog and smog. Thank you. Oh, I'm sorry.
वो तो मैंने कैमरा शट कर दिया.
Screen share.
हाँ, अभी मैंने कैमरा ऑफ कर रखा.
नॉर्मल रखो, प्रेजेंटर्स
मैम,
मोड
आप-
में मत करना, कोई बात नहीं.
ठीक है. आप टीवी में देख करके बोल सकते हो.
नहीं.
पीपीटी
टीवी में देखो, मैं फ्लिप कर दूंगी. टीवी में देख लो आप.
क्योंकि ना इजी रहेगा.
स्क्रीन डॉक्टर रूबेन नहीं दिख रही है.
अभी नहीं दिखेंगी. 16 पे थे ना.
कौन सा स्लाइड नंबर है?
16
मैं कर रही हूँ.
ये था ना.
स्क्रीन मैं फ्लिप कर दूंगी तो वो कर दो.
तो आप उधर देख के बोल सकते हो आराम से.
इसको फुल स्क्रीन नहीं कर सकते हैं. हाइट प्रेजेंटर्स व्यू कर दो ना.
लाइव में तुम्हारा तुम तो नहीं आ रहे.
हाँ,
नहीं अभी तो नहीं आऊँगा.
हाँ, अब इसको फुल स्क्रीन कर दो, हो जाएगा. नहीं,
फुल स्क्रीन का ऑप्शन नहीं आ रहा है.
टीवी में देख लो डॉक्टर रूबेन.
दैट्स ओके. नहीं, इसमें नहीं कर सकती.
इसमें
भी
फुल
आ ही
स्क्रीन
रहा
नहीं
है.
आ रही है.
इसमें भी आ ही रहा है.
आप
ठीक है.
वहाँ पे आराम से देख सकते हो या फिर आप अगर इसमें से पढ़ सकते हो तो कैमरा में ऑन कर दो. अभी आप म्यूट
I
आप
think
अनम्यूट कर लेना.
this is fine for
Fine
me.
ना?
हाँ.
कैमरा ऑन करो और अनऑन कर दो.
आप अनम्यूट कर दो.
Yes, I'm so sorry. We'll get back to the difference between fog and smog is what I was telling you. You can read on the slide how The pollution actually makes it more difficult for the nature. All right. Heavy metals and the oxides, they are basically from fuel combustion industrial processes. What will it basically lead to is a lot of itching, redness, and dryness. Chronic illnesses, again, like psoriasis, cancers, will get worsened in these conditions. Now, if you can see, there is a yin and a yang. The black yang, if I talk about, is something when the pollutant gets activated on your skin. What will it lead to? Oxidative stress, a lot of inflammation, a lot of diseases which will happen. But when I talk about the yin part, wherein it is not activated, it will have a lot of anti-inflammatory activity, antioxidation. Isliye, we have a lot of antioxidants in our diet also, and to apply. The barrier function will be better, and of course, it will promote. It will be protection. It will be little protection from your hyperpigmentation. How do we protect ourselves? This is I think the most asked question in my OPD. Number one, physical photo protection. Please don't think physical photo protection is only a sunscreen. It's also your caps, your sunglasses, your protective clothing. Try wearing lighter colors than the darker ones, because the darker ones are not going to reflect but absorb the UV light or the sunlight that you're in. Avoid going in areas wherein there is a lot of smoke, or a lot of public smoking is happening. Topical antioxidants, they really help. So CNE should be an everyday thing, edible, and also application for the certain skin types that is it's advised. Indoor air purifiers, plants, ventilators, they will all help. Using mask in areas where there is dense pollution, dense smog. So for, of course, people who are in these jobs, it will really help you. Now, this is, I think, my favorite part is diet. Water intake has to be 3 liters. Every 20 kgs requires 1 liter of water. Please don't have more than 3 liters. It will start dissolving your electrolytes. So 3 liters of water is a must. Diet, I don't want you to stop eating stuff. I want you to eat the right things. So when I talk about vitamin B3, C, E, omega, carotene, selenium, green tea, chia seeds, omega, fish, we have greens. They all are rich in antioxidants. All the antioxidants that you eat and apply, please make sure that it's going to take care of the oxidative stress caused on your body. So the excessive dryness that you feel happens is not going to happen with the antioxidants. Now, how do we take care of our skin? Cleansing is very, very important. Please don't think that I'm not going to wash my face, I'll just wash it with water and it's going to get protected. No. So, cleansing is actually the backbone of the skincare regimen. Uh, the UV damage, dryness, wrinkles, hyperpigmentation, of course. How will you actually cleanse? You are going to wash your face according to your skin type. If your skin type is dry, we will prefer a moisturizing cleanser. Or if we are an oily skin type or a very acne prone skin type, we'll give you a foaming wash. Foaming face wash is what is recommended. That is, you need to wash your face nicely twice a day, and around your nose, lips, and at the back of the ears are the areas which are very important. Twice a day, like I told you, is very important. The morning cleanse actually builds a sheet. It's not supposed to be very aggressive. It has to be very medium to low, is what I can say. Why? Because if it's very, very aggressive, it will lead to dryness throughout the day. So again, a gentle cleanser, like I told you, with hands or a washcloth. A toner is not advised for everybody. I've written it here for my oily skin patients, for patients who have very oily, greasy skin. So alcohol-based toner or serums are recommended for them before the sunscreen. So toners are very good after you wash your face. They are actually going to take care of the pH on your face, and also your skin barrier is going to be protected by them. A good moisturizer for all my dry skin patients, for patients having normal to dry skin, especially in the pollution weather. I would say it will act as an additional barrier, or choose for a moisturizing sunscreen. please, I've been through the entire presentation. I request everybody, please use a broad spectrum sunscreen thrice a day. Every 3 hours is super important. And given the AQI right now, I would say in the evening, if you're stepping out of the house, please use a good broad spectrum sunscreen for yourself. Now, I have a lot of patients who have, these commitments wherein they are supposed to look a certain way. I ask them to use a tinted sunscreen. Tint will add an additional protection on the face. With sunscreen, post sunscreen, if you want to add some makeup, you can do that. Mix with your sunscreen again and then use it on your entire face. Evening cleanse is very, very important. It has to be a little harsh than the morning cleanse. It has to be more cleansing, basically cleansing your suit and other pollutants out of your face. So it has to be a little longer, so maybe 10 to 15 seconds if you're 5 to 10 seconds if you're taking in the morning cleanse. Then 10 to 15 seconds is a good time for the evening cleanse. Also, if it's too oily majorly around the nose and the lips area, we can leave the foamy cleanser for 5 seconds on the face. Now, glass skin, basically, it's a very, very viral trend. When I talk about glass skin, it's actually like a cut piece of glass. Koreans are basically following this phenomena. I think, there are a lot of myths and there are definitely certain facts that are presenting that Korean skin type is different. It's much thinner. It has less pores. The genetics is totally different. Their diet is totally different. So we can never have a skin which is totally photocopy of a Korean skin, which we call as a glass skin. But yes, having an Indian skin, which we should be very proud of, we can achieve that, glass skin glow. Now, glass skin is basically, it looks like a cut piece of glass. So, in their skin type, they flush it with ceramides, humectants, scrubs, and everything to basically hydrate it to a level that it looks like a glass skin. Like I told you, it's a thinner skin, it needs more protection. So, if we are going to do that more on our skin, we will feel more oily, we'll have more acne here and there, and we'll definitely have these acne and itching issues. So, the first myth is that by applying these products consistently, if I do it every day, say for a month, will it help me? Not at all. Don't think that you only apply something, you don't take care of your diet. Like I told you, antioxidants, water, your workout, your intake of protein, daily intake of protein, your fiber, that's really, really important. So that is really going to take care of the skin. Something that you apply is going to do a sealing on the top. So that is 20% is what you apply and 80% is what you eat. These products suit everybody. So my colleague bought it and she used it, and definitely I think कि मेरे को भी suit करेगा. Let's buy all these products and start using them. Your skin type is different. Maybe your colleague has a drier skin type and she needed all these humectants and thick moisturizers for her skin to get better, but you don't. Maybe you have an oily skin type or a normal one wherein just a moisturizer and sunscreen will help. So please don't think that your skin type is just like your friends or maybe your colleagues and all these products will help you. And I think this last one is the most asked. That snail mucin, doctor, I've been using, and I think I'm getting a lot of acne, and these marks are not fading away from my face. See, snail mucin is what? So on a big net, these snails are left. So whatever remnant or whatever liquid that flows out of their body is known as snail mucin. Definitely, it has very good inflammatory properties. In Korea, they use it as a medicine as well. Vitamin C, A, E, it's rich in that. It's not FDA approved. So there are no trials to support it. Secondly, the box of snail mucin that you've just bought for the market, how are you sure that it's not a synthetic snail mucin? I'm damn sure it is uh, synthetic, because a natural one has an expiry and it goes away in some time. Because all these vitamins and minerals that I'm talking about, they fade away. So please don't think all the snail mucin creams are going to give you that glow and that hydration. We have these very good ceramides which are available in the market, and they will definitely give you that glow. Lastly, I like to just cover up with a a little bit of fun that being 30 in 1994 was having good hair locks and not having that much of aging, even if you can see the neck. And wherein when I talk about being a 30-year-old in 2024 definitely has a lot of hair fall, a lot of aging that has happened on the face. Like we covered, bony prominences you can see around the chin is more, and neck is definitely more aged. So please take care of yourself and take care of your diet. Then be very sure that your pollution is not going to affect your skin. Thank you. I think let's take the questions now. Okay, so we have the first question. What are the best skincare practices for different skin types? Oily, dry combination, and sensitive. Okay, when I talk about oily skin, number one, you're very lucky to have an oily skin. Why? Because there is some part of sebum that is always thrown out on your face. Sebum will protect and hydrate your face. So make sure that you do not need a moisturizer. You might need some hydration. Hydration meaning if your skin is getting dry, you need a hydrating cleanser or maybe a hydrating sunscreen. You do not need too many things on the face. You need a good sunscreen and maybe a good anti-aging cream as well. Dry skin patients, they suffer a lot throughout the year because initially it's not that dry, but they feel stretchy on the face. We will do a lot of moisturizing cleansers there, a lot of moisturizers before and before sunscreen and even during the day. And before sleeping we can do a lot of hyaluronic acid, niacinamide, and all these serums, but please locked in with a moisturizer. Sensitive skin, it is a very difficult thing to just comment on a sensitive skin type right now, because sensitive skin, it really matters on which part of their face is more sensitive. It's majorly the nose and chin, but for some people it's the cheek area, and for them we cannot give any other product to them. They have a lot of issues with respect to hydration also. Plain hydrating cleansers, they cause a lot of problem to them. So we need to give them a lot of thick hydration, moisturizers, and retinols or anti-aging treatments if they want to do. We have to be very watchful because their skin acts up very easily. So the combination skin is good in both the weathers. You can do all of these products throughout the years. Just throughout the year, sorry. Just by the end of the year, you would need a more moisturizing sunscreen and a moisturizer before you sleep. What should we keep in mind when selecting products for sensitive skin? So, when you talk about sensitive skin, any acid, be it alpha or beta acid, they are going to act up in that. So, more hydrating products, sunscreen are a must, even indoors. And majorly, like I told you, the retinols and the niacinamides, they can actually act up. They can easily, their skin can blow out of proportion red after using a product. So I normally tell them use more moisturizers. Hyaluronic acid is very good for you. You can do that in cream or serum form. And don't experiment with the product too much. Do a test patch on your neck first for 7 days at least, and then try the product on the face. All right. One second. Are there any foods that can help improve acne-prone skin? Yes. So there has been no study claiming foods causing acne, but we've definitely seen a lot of dairy, sugars, and oils. They cause more inflammatory exudates in the body, which causes more acne. Hence, I totally tell them to get out of their system, especially with these three products. And when I talk about what to eat, we should eat a diet which is more rich in fiber and protein. Protein should be there in all three meals. Please don't depend on the synthetic protein because that is not easily taken up by your body and it's not metabolized. Hence, it will give more truncal acne, back acne, especially with my male patients who start having synthetic protein 2 to 3 scoops a day. That becomes a problem. So you need enough water intake to flush that out of your system. More fiber and more protein, like I told you. Carbs are very good. Please don't avoid them, but probably limit your sources of carbs, and be very watchful of the oils that you eat. So, I have these patients who tell me that, doctor, I don't like eating, these chole bhature, etc. But I love having a packet of chips by the end of the day. So you are consuming oil. It is more junk. It has more preservatives. So there's no point in doing that. All right. What is advisable to remove blackhead? Okay, so I know that you would be knowing about the blackhead remover strips and the gels and the creams. Majorly, blackhead, I do not advise my patients to do it themselves because they press it out, or maybe in the salons, they are not pressed vertically, but they are pressed horizontally down, which creates a scar. If you want to, you can purchase a comedone extractor and you can just vertically press on the blackhead and take it out. But please be sure, if you've done it, the pore size is going to open up and it might lead to scarring. So I think you should ask your doctor. A lot of blackheads, they are very superficial. So with a good cleanser, they are taken out. You should not, I think, play with your skin with respect to blackhead, because that is one type of, that is type 1 scar. It is majorly present on major, like all these females and males who pick on their skin. So please don't pick on your blackheads. Do you recommend hydrofacial for oily skin? Hmm. Hydrofacial is good. Why? Because it has this scrubbing and these agents which are just given in your skin type. Any kind of facial that you choose in a medical facility, that is, we call it medifacial, is always gone through the doctor, and then the products and the facial is decided according to your skin type. So hydrofacial, if you want to go ahead with, you can definitely tell the doctor doing your hyd, or maybe in the clinic that you're in, that you have an oily skin type. So the products that are used for you are just hydrating and not moisturizing, because a lot of massage, a lot of moisturizing products are going to give you more acne. So going through the facial is not a problem. Getting it done, maybe not as frequently as a drier skin type, but then it is going to help you. That's not a problem. It's like not like a no. At what age to start retinol? Now, ideally, according to guidelines, it's 25 is the age group that you start aging at. So it's a safe time to start an anti-aging product then. But it really matters on what kind of retinol you're using. So there are three types: low, medium, and high. So these over-the-counter products and people below 30 years of age group, they need retinols which are low in potency. So 0.025 to zero point 0.5 is low potency. You can start with retinols. Choose your product wisely. Don't overuse the product. First test it on your neck. Do it for 5-6 days. You'll get to know whether it's reacting on your face or not. So if it's really reacting on your face, you need to stop using the product. So 25, after 25, you can start using a retinol. All right. What are the best acne treatments you would suggest? Is microneedling safe to choose? Yes, so acne ends up with scarring in maximum of the cases, because the time when the patient reaches me, the scar has already formed. So when I talk about acne treatments, we, according to the scar type, we decide what kind of treatment we want. If the scar is deeper, so majorly rolling or box scars, we will have to invade. Now, invasion on the boundary matters. Micro needling has 2 to 2.5 mm of depth. Micro needling will really help you. Why? Because the skin texture is going to get better, newer skin cells are going to be formed, and it's not going to be happening only for a given amount of time. It's going to happen for longer amount of time. So your skin change is going to happen. So I normally recommend micro needling to maximum all of my acne prone patients, or maybe scar patients, because 2.5 mm is the least depth that we go at. Now, if the scar is much deeper, then we might need invasive lasers for a better skin turnover. And is microneedling safe to choose? Definitely. So, if the patient is pregnant, lactating, or maybe has a long term condition, some medicines the patient is following, then we cannot. But otherwise, microneedling is a very safe process and it has brilliant results. Which moisturizer is good for acne? So for you, gel-based moisturizers are very nice. We have a lot of companies doing that. Please don't go in for the moisturizing cleansers, when moisturizing, sorry, creams, because they can give you more acne. You need more water-based products, more gel-based formulations. So when I talk about moisturizers or makeups, it has to be more gel-based. Okay, what clinical method and product is recommended to manage open pores? See, open pore is nothing but a mouth of your skin. So, if you talk about how can I take care of the mouth of your skin, is by double cleansing. So, morning and evening cleansing is very important. Sunscreen has to be chosen according to your skin type. Is your skin type very, very oily? Then you do not need a moisturizing sunscreen, because all these products are going to settle in your pores. So we have to be really watchful on that. And how to manage them? Retinols are really safe, very good for you. Secondly, these procedures like microneedling, lasers, these ablative procedures are good for you. Yet again, they do not give a very satisfactory result, as satisfactory it is in acne scars, but they actually give you a solution to the problem that you're facing. How safe is laser hair reduction and is it painful? Laser hair reduction is totally safe. It's only 500 nanometers. It's not. I mean, you would have seen UVA is more harmful. We are still not using our sunscreens. We know that whenever we get our nail extensions done, they put our hands in the UV light, and we very happily give our hands in the UV light without using any sunscreen on our hands. Again, that's a carcinogen. So please don't ever think that doing a laser hair reduction is going to cause some side effect in the later part of your life. Nothing will. That's not at all. That's the biggest myth. During pregnancy, lactation, or maybe some skin issues, I don't recommend. But there are very meager issues that we don't do LHR in. But otherwise, we can do it. And how painful is it? It is definitely not painful at all. You will not know that the laser has happened. The technologies have really gone up. Now we are using much better technology. The pain is minimal to no. I don't think so. Any of my patient till now has complained about pain. So it's very, very safe. Which type of sunscreen is used for dry skin? It's majorly the moisturizing sunscreen in throughout the year. And during by the end of the year, that is the December to January weather, you would need another moisturizer top up after your sunscreen. So you need more moisturizing products and a moisturizing sunscreen. uh, is laser hair reduction program related to the quantity of hair growth and age? Not really. Your The amount of laser shots that are given are pretty specific. We know how much to give. The type of hair you have, that matters on what kind of hair you have, whether we can do laser on that, yes or no, but not exactly the number of hair. If you're talking about hair being very fine, we will not do the laser, but majorly the hair are thicker on the body parts, so we can cater to that. Age is generally preferred after a girl has gotten a period for the first time, so 1 year post that. So that's majorly until 14 years of age. We can, after 14 years of age, we can start laser. How to identify skin type, whether it's oily, dry, or combination? Because okay, so sorry. All right, I'll take it. Should sunscreen also be used during winters? Of course. Sunscreen is a definite must. Please don't think that sunscreen is not required. Indoor and outdoor pollutants are definitely there. You need a sunscreen every 3 hours until 2 p.m. And if you're going out in the evening, you need a sunscreen in the evening as well. The first coat should be sunscreen before your makeup. Hi, doctor. Can you suggest natural product name for men's skincare? Natural, I don't know, but salicylic acid is very good cleanser for male. And for sunscreen, we don't have a gender. Sunscreen can be used by both the sexes. Males don't need much of hydration on their face. They have more sebaceous glands, more sebum. Hence, when I talk about moisturizing with respect to men, it's majorly hydration rather than moisturizing. What would be special recommendation for men and newborns? So men don't use much hydrating products. You can use sunscreen regularly. Sunscreen is every 3 hours for you as well. uh, Majorly male patients, they think that half of the face is covered with beard area. What's the point of doing any skincare? It's very very important. Please don't think the upper one fourth of your face or maybe the two fourth of your face does not require need. It definitely requires a sunscreen. And for newborns, I normally say you just use a good moisturizer, a body lotion. That is okay for them. Don't give them fragrant products. With newborns, we don't do many moisturizing, like a lot of products on them. Less is more for the newborns. Next 3 months would be tough for skin given the pollution. Any special tips for two-wheeler users? Yes, you can use a mask. Always use a helmet. Improvise on your diet. Make sure you use the sunscreen half an hour, minimally 15 minutes before you step out of the house. As soon as you're back from work, you wash your face nicely and use a good moisturizer if your skin needs it. And it's high time you start a retinol because the skin turnover will start to get better. Could you recommend some natural antioxidants that improve facial glow? Yes, so we have amla, palak, chia seeds. We have all the dry fruits, eggs, chicken, fish. A good preservative food. So natural preservative, may we can talk about kimchi, pickle, prebiotic, probiotic foods. They are very very nice. Antioxidants which really help you is A, C, and E. So in E we have it in almonds and walnuts. A is majorly in all the greens, your beetroot, gajar, everything. And C, I majorly recommend amla to maximum of actually all of my patients. Vitamin C is there in broccoli. It is there in lemon, amla. So please make sure that you have include all of these in your diet. Ma'am, any cream or face wash you would recommend for dark skin guys like me? No, see, skin color is never a deciding factor to give a product. It is your skin type that we decide on. May be that your skin is more oily. That is the reason a lot of dirt and grit is coming on your face, which is causing you to look a little darker. So I would say a more foaming face wash for you and a sunscreen, please. Hi, doctor. What should we keep in mind while selecting? So, sensitive skin, like I told you about, be very, very watchful. More of hydrating products, a good sunscreen, and please make sure you don't experiment as much. Be in touch with your doctor because a reaction happens very easily with a sensitive skin type. Okay. Shall we walk with masks on? Yes. Areas which are high on pollution, areas which have more smoke, and some areas which are given for smokers. On these areas, I would recommend that you use a mask always after a sunscreen because that will act as a physical photo protection for you. Any diet recommendation that will help to improve acne prone skin? I've covered that up already. So we'll do less of dairy, oils and sugars, and more of homemade food, less of packeted and preserved foods. And we'll do workout regularly with our acne prone skin patients. How important is hydration for clear skin, and how much water should we really drink? Okay, thank you for asking this question. Water is very very important. Something that the pollution takes away is the water from your skin. So make sure you're having at least 3 liters. So on every 20 kgs, I say you have 1 liter. If you want to really know the stats, it's 35 ml per kg. So it comes to somewhere around 800 ml per 20 kg. So I mean, 1 liter is minimally, that is what I advise per 20 kg. So 3 liters are a must. If you go more than 4 liters, then the electrolytes they start to dissolve. So that I don't recommend. And okay, I've answered the how much water should we drink. Hi doctor, I have an oily skin and I have already taken many treatments for my oily skin. Could you please tell me what are the top things that need to be taken care of if you have oily skin? Oily skin, please don't moisturize. Treatments with respect to your skin don't only matter because of the skin. Maybe the skin problems that you have, maybe you've treated them. Oil collection is more, so you need more cleansing agents twice a day nicely. Sunscreen which suits your skin. No to moisturizers regularly, only when you need it. So a moisturizer is always an SOS for an oily skin type. And how to take care. You don't have to care about your skin as much because you're blessed. Sebum is taking care, it's hydrating and protecting your face. You're not aging very easily. And majorly with oily skin, it's more pocket friendly because you don't need to invest in too many products. So oily skin is definitely a blessing. How can we reduce dark circles? Okay, so dark circles is a big concept. Why do I say that? Because a lot of shadowing happens in dark circles. So around your eye, there is a lot of shadowing happens because as you age, the fat goes down. So sometimes we need to do certain procedures and not just give you creams to apply. So that should be a diagnostic factor for dark circles. Other than that, 6 to 7 hours of sleep and a diet rich in whatever I told you, ACE, antioxidants, and water, that should help. Do diet and lifestyle affect skin health? If so, what should we be mindful of? Diet and lifestyle is 80% of your skin. So please don't think that I'm only going to apply or do and it's going to help me. Have a more fiber and protein rich diet. Don't choose carbs the first source of when you eat food. Make sure you work out 5 times a week rather than putting things on your face, doing DIYs, looking at different locations. You can just eat them rather than apply them. So having a good diet does not mean that you're following certain diets which allow you to eat certain foods, and they don't allow you to eat certain foods. Please don't do that. Follow a diet which is enriching all the bodily needs that you have. Hi, doctor. Could you please recommend a good moisturizer for dry skin? See, any moisturizer which is ceramide and PEG rich is good for you, but depends on how much dryness you have. So, if you wash your face and after that you have dryness, or throughout the day you have dryness. If you have dryness throughout the day, you need more thicker moisturizers which stay throughout the day. So, please don't depend only on ceramides. You might need more humectants also. Okay. Thank you, doctor. Please suggest some natural remedies for facial glow. Just have a good diet and stay happy and work out every day. Can you recommend a product that will help achieve an even tone skin? Yes. Product again will not help. You need a good diet. You need a good skincare routine. I have already been through the routine that you should follow. And water intake should be at least 3 liters. Okay. Let's see if we have other questions. Okay. Huh. Huh. Is laser hair reduction program related? Oh, I already answered this. The growth and age doesn't matter. The type of hair matters. Age, I've already told you. We can take females who've attained 1 year more than after their period. We can do that. How to identify skin type? Okay, oily, dry combination because sometimes it's too oily. Now, first and foremost, you can take a trace paper and you can just put on the sides of your face. So where all three areas, one is your cheeks, other is your forehead, other is then third is your chin. Just take a trace paper, let it be on your face for another 20 to 25 seconds and or maximum 1 minute, and then just take the paper out. If it's oily and sticky, then that means there is a secretion of sebum on your face. Your skin is somewhere between oily. Now, how do I decide that? If all the three areas have oils, it is oily. If the two areas are dominantly okay, but one area is oily, that is majorly the cheek part, we call it normal to dry. And if all three areas have no sticky dryness, or they just maybe fall off very easily, we call that skin a very drier skin type. Your skin might have issues, majorly some hormonal issues, or you're doing a wrong product. So, because if you feel very oily, or maybe sometimes you feel very dry, you're using a wrong product. Either using a very hydrating product, thinking your skin is very dry, wherein I feel that maybe your skin is normal. You don't need too much of moisturization. You just need a little hydration. And in winters, you might need moisturization. So this would need a little more, examination to diagnose what's the problem. What are the main reasons for developing acne vulgaris? Share some preventive remedies. Acne is basically a problem of your sweat glands. Now, it is a condition and not a disease. So, when I talk about acne, please be sure diet plays a very important role. Acne is very okay with teenagers. It happens because of their hormones are going up. It will happen during pregnancy. It can also happen, which is a major concern these days, is PCOD. You have to actually take care of your diet. You have to work out. These days cortisol is not only up for us but also the little kids that we see, majorly the teenagers. They are going through so much that nobody understands. So workout or a regular sport is going to help the cortisol to go down. Again, going back to my presentation, oxidative stress will increase inflammation. Inflammation will increase acne. So again, anti-inflammatory foods, a lot of workout, and definitely the right products on the face. So if somebody has acne, they use a lot of products. कि ये भी लगा लेती हूँ, maybe this will give me relief. Majorly acne-prone patients, they know they need like not many products as much as they use. How do warts occur? Warts. Okay, sorry. Yes, warts. Warts are a viral HPV. It's a viral infection. We need to remove them regardless of the location. Now, the type of treatment that we do matters. Where are we doing the wart removal? But if wart is there, we normally say you remove it because you are going to spread it on your body and on the other body parts that you have. Cleanser and moisturizer is same? No, cleanser is a face wash. Depends on you need a degreasing cleanser or you need a moisturizing cleanser. Moisturizer is a cream that in layman language you say cream. The moisturizer is basically a cream. The depth of the moisturization matters. Hence, a moisturizer is not advised for all skin types. Okay. What are your OPD timings? How do we take your appointment? All right. I sit at CK Birla Hospital, Gurgaon. My OPD timings are 12 to 6:30, Monday to Saturday. You can call, you can just Google CK Birla Hospital. There would be a number. You can directly call on that number and you can easily get my appointment. I think we're done. Is face wash and cleanser same? Yes, face wash and cleanser is the same thing, but face wash majorly is taken up as a like a foaming wash, like which washes away all the normal pH and the oils from your face. So for everybody, we don't need that. Hence, I call it a cleanser. So it can be a foamy cleanser, a degreasing cleanser, or a moisturizing cleanser. But to understand it better, yes, face wash and cleanser is the same thing. I'm sorry, one second. Can staff avail any discount on services? Of course, yes. I think we have 50% discount on all the services with for our staff, and we can start from the day you choose to start the service. I think we are done. My pleasure. Okay, one second. Is it okay to apply basic makeup every day and follow cleansing regimen at the end of the day? Rashmi, I would advise that you use a tinted sunscreen. You can easily get it from any pharmacy. Basic makeup is going to clog your pores because you're going to use a primer, then you'll use a foundation, then you'll use a loose powder. You will end up getting more acne on the lower part of your face. I would advise you to use a tinted sunscreen on everyday basis. Use organic products on the cheek if required. Now, follow a good cleansing routine for yourself. So you have the micellar water, etc. as well. You can do that, but please see how dry your face is by the end of the day. If your face is very dry, use a moisturizing cleanser and make sure that you use a good moisturizing cream or a retinol based anti-aging cream by the end of the day, because the makeup is definitely going to cause some pigmentation, some harm on your face. So that is going to be taken up either with hyaluronic acid or the retinol. Yes, I think we are done. Retinol, see, it comes in different frequencies. So if I'm going to talk about, if suppose if my patient is 25, I'm not going to give a higher percentage of retinol. Also, so retinol is too much available in the market, so it is also available as a over the counter brand. It is also available in medicated products. We really have to examine the skin to see whether the skin needs retinol or not. Now somebody has asked me about sensitive skin. If I'm going to give them a medium percentage of retinol, they'll have a bad rash on their face. So we really have to see and examine what kind of retinol will suit their skin, and whether or not retinol will suit them. So they can, if suppose you've bought a over the counter product of retinol, just try it on your neck first. Try it for 3 4 days, and then if it goes okay, and if you have no rash, you can go ahead with applying them on your face. One. Number two, hyaluronic acid majorly suits everybody. So you can do a hyaluronic acid serum if you have an oily skin type, and a cream if you have a normal to dry skin type. Niacinamide and all these serums now available have a very debatable role, so I cannot be commenting on that. Sure. My pleasure. My pleasure. End कर दो. तो जाओ. हाँ.